Brachytherapy. Brachytherapy or inner radiation is a type of radiation remedy that works by inserting a radioactive device inner of a patient's tumor. Brachytherapy. We could doctors use higher doses of radiation in extra precise places than radiation remedy that works by inserting a radioactive device inner of a patient's tumor. Brachytherapy. We could doctors use higher doses of radiation in extra precise places than traditional radiation therapy would permit. Doctors may additionally apply brachytherapy in lots of methods, placing the radioactive supply during surgical operation, putting the radioactive supply with the usage of an imaging test, applying it quickly after surgical operation to prevent most cancers from spreading. Brachytherapy is not often used to deal with mesothelioma. Radiation remedy system. Even as the system of radiation therapy can also range from patient to affected person, it typically follows the same primary steps. Preliminary consultation. The mesothelioma affected person meets with a radiation oncologist, a cancer medical doctor who specializes in treating patients with radiation. The patient will carry documentation which includes previous. Doctor will decide a radiation therapy remedy plan and give an explanation for it to the patient, who need to sign a consent form before remedy can continue. Imaging scans. Mesothelioma. Experts have to create accurate imaging to let them recognize where the target location might be for radiation therapy. They do this the use of a computed tomography (CT) device, which takes more or less an hour to create a simulation of the patient's frame. Remedy guidance. At instances, medical doctors can also create a faint marking on an affected person to make sure they perform the most accurate radiation remedy viable and keep away from as much wholesome tissue as they are able to. They'll also create molds to defend a patient's face or other areas of the body throughout radiation. Remedy. In keeping with the countrywide Most Cancers Institute (NCI), radiation treatment is typically finished 5 days per week and keeps for 5 to 6 weeks. The average length of time for each day radiation treatment is 15 to 30 minutes. Comply with UP appointment. Follow-up appointments. Generally, an exam for any signs and symptoms of facet outcomes. The radiation remedy can also reason. A mesothelioma affected person's physician may also order imaging scans to peer if the tumor is shrinking in response to the radiation. Side results of radiation therapy. Despite the fact that radiation oncologists do the entirety they can to guard surrounding tissues in the course of radiation remedy, damage to healthy cells can occur and can result in aspect effects. Some patients experience many aspect outcomes, even as others have only a few. Radiation remedy aspect results depend on location of the area under treatment, length of the area being treated, radiation dosage level, treatment frequency. Side effects can manifest at some stage in remedy, or without delay, after, but most take weeks to develop following remedy. Some radiation side effects mesothelioma patients might also experience: fatigue, loss of appetite, hair loss, nausea, vomiting, skin problems, lung inflammation, inflammation of the intestines. Luckily, your medical team can help manage any aspect effects. As an instance, pores and skin problems are usually handled with topical creams, and infection is handled with oral medicines. Get a mesothelioma radiation remedy. New research is supporting doctors higher understand how radiation therapy can be used to fight mesothelioma. This includes studying approximately the handiest methods to manage radiation and which sufferers can benefit most from this remedy. For more statistics about receiving radiation remedy from a mesothelioma professional, contact Mesothelioma Wish today. Our affected person advocates will solution any questions you've got approximately radiation therapy and assist you discover a radiation oncologist.